Hello everyone, it's Kenji and we're back again with our pharmacology course, and we're still completing the pharmacokinetics part. In the last two videos we've explained the absorption on two parts, the factors that do affect the absorption, the drug-related factors, the site-related factors, and in the second video we've explained the mechanisms of absorption, the four different mechanisms inside your body, and how your drug gets absorbed. And we're in the second part of the ADME of the pharmacokinetics, which is the distribution part. And without further ado, let's get started. First of all, what is distribution? Distribution is simply when your blood gets successfully absorbed. And by absorbed means that whenever you administer a drug and then it gets to the site of absorption, and this, let's say, for example, it's the intestine, and then it gets absorbed through the microvilli, regarding all the factors that we mentioned in the absorption, gets absorbed inside your blood successfully. Distribution means that it's going to get out from the blood plasma to be distributed in all the interstitial parts inside your body. Interstitial parts means mainly the fluid compartment, the water between the cells of your body and the blood plasma, and inside the cells themselves. Distribution means distributing the blood simply all over all of your cells and all over all of your fluid compartments inside the body other than the blood, because it already got absorbed in the first place inside your blood plasma. So distribution means it's getting out of the blood, simply. There are some factors that do affect absorption. First factor is the blood flow. What do I mean by blood flow? We mentioned in the absorption, when we were talking about the site-related factors, if I remember, that there are some organs, that do get higher blood flow than other organs. For example, the liver. The liver generally does have higher blood flow than other organisms. For example, the kidneys. They need higher blood flow for the filtration process, the reabsorption process, and the secretion process, and the renal filtration. And the spleen. If you don't know what the spleen is, it's an organ that does work in blood filtration as well. For like the damaged RBCs, it has immunological functions as well in protecting the blood. And it can work actually also as a reservoir for blood platelets. We can write these. I think it's important. Blood filtration, and can be used also for as immunological functions, and it also can be used as a reservoir for blood platelets. All right, so that's for the spleen. So these organs do have higher blood flow than other organs inside the body. So this means that these three organs will have higher distribution rates. Why? Because if you remember the definition that we've said about distribution in the beginning of this video, that it's simply the drug getting out of the blood plasma to the other parts of the body, to the cells of the body. So when you have an organ that naturally do have higher blood flow, it means that when the drug gets absorbed to the blood circulation that's related to this organ specifically, it's going to get distributed in the cells of this organ faster than other organs that do have lower blood flow than this organ does. So this means that higher blood flow equals higher distribution. And let's write that. Higher blood flow equals higher distribution, and lower blood flow equals lower distribution. Higher blood flow is higher distribution, and lower blood flow is lower distribution. It's as simple as that. All right? Okay. All right, moving to the second factor that does affect absorption is the capillary permeability. Some capillaries of some organs are anatomically formed in a specific way, and others are anatomically formed in a different way. why there are differences between the capillary permeability of some organs other than some organs. This is for a very important reason. For example, there are some organs that their capillaries do have these slit junctions. These are called slit junctions. Just a moment. Slit junctions. And this type actually of capillaries is called discontinuous capillaries, or sometimes called sinusoidal capillaries. All right, let's write capillaries. What are the organs that do have these type of capillaries? We have organs like the liver, because the liver mainly is used for metabolizing drugs. When you are used for metabolizing drugs, you need to be more permeable for having to accept larger particles of drugs. You know, that's why they have these slit junctions. That's why the liver does have these slit junctions. Slit junctions. Did I say slit junctions? What the fuck? What the fuck? I've just said slit junctions. I just said slit junctions. You slut. Ah, for fuck's sake. Oh, for fuck's sake. Okay. And the second factor that we do have is capillary permeability. Capillary permeability means that some capillaries of some organs do have different shapes than how the capillaries in other organs anatomically are formed. Why there are differences? For a very important reason. For example, some organs, their capillaries have slit junctions inside of them, have these discontinuous parts, slit junctions. And this type of capillaries is called discontinuous. Discontinuous. Just a moment. Or actually also called sinusoidal capillaries. What kind of organs do need this sinusoidal capillaries, these discontinuous that do have slit junctions in them? The organs that need to accept larger particles of drugs, like the liver, for example. Why does the liver need to accept larger particles of drug? For metabolism, of course. Liver is the main organ for metabolizing drugs. Kidneys, the main organ for filtration and reabsorption. It needs to accept larger particles of drug. The spleen also, and we mentioned its function earlier. So these kind of organs do have sinusoidal capillaries. There are some other organs that it's extremely dangerous for them, for these organs, for the functions, for them to actually function if they do have discontinuous capillaries, like the brain, for example. The brain, you cannot have any kind of particles or large particles or any drug, for example, to be getting inside the brain. And that's so dangerous for your brain. So the brain is the main organ. All right, let's write just the type of this capillary first, which is a continuous one. The brain can have slit junctions in its capillaries. They need to be continuous. They need to be closed to not allow any kind of particle or any kind of substance to get into the brain easily. The brain needs to be protected. It's our most precious organ. So the brain, another organ that does need to have continuous capillaries, is the muscle. Why the muscle? Because the muscle, actually, for the muscle to function, for it to have a proper contraction and relaxation process, you need to have a tight control over the gas exchange that does happen, the oxygen content that gets inside of it, the protein content, the nutrient content. That's essential for the muscles to actually contract properly. So that's why the muscles also need to have continuous capillaries. So the capillary permeability will affect the distribution of the drugs. High distribution and the discontinuous in the organs that do have discontinuous capillaries, and lower distribution in the organs that do have continuous capillaries, like the brain or the muscle, discontinuous like the liver, kidney, or the spleen. There's a third factor that does affect the distribution of drugs, which is binding to a plasma protein or binding to one of the tissues of the body. First of all, let's talk about the plasma proteins. What do I mean by plasma proteins? I mean the proteins that are rotating inside the plasma of your blood. And the most famous one, for example, is the albumin. Albumin, which gets manufactured in the liver. Let's say plasma proteins, just write the example first before getting to complete. Plasma protein. Okay. The most famous one, for example, is albumin. Albumin is manufactured in the liver. Some drugs or some substances naturally are protein bound. What do I mean by protein bound? When they get absorbed inside your body and they are already in the plasma of your blood, they are um, naturally bound to the proteins that are found inside your plasma, like albumin. They like to be bound to these proteins. So if you're, for example, administering a drug that's protein bound and it gets bound to plasma, let's just throw it for better demonstration. Okay, I'm sorry. That's our drug. Okay. D stands for a drug. We mentioned that in the previous videos. And here we have, let's say, that's albumin, for example. So this drug is a protein-bound drug. This protein-bound drug, because it naturally likes to be bound to proteins when it's inside the plasma, will be bound to the albumin when it gets inside the plasma. So, do you think this will decrease the distribution of this blood inside your body, or will decrease or increase the distribution? Think of it as, do you remember when we talked about the factors that does affect the absorption, especially the drug-related factors? We've mentioned something called the combinations. For example, tetracycline, which is a broad antibiotic, when it gets administered with calcium, it gets attached to calcium, and then it makes a complex. This complex decreases the absorption of this tetracycline. It's actually here a similar concept. It's like a complex, but not really the same concept. It's a similar one for that, just for you to understand it. When this drug, the protein-bound drug, gets attached to albumin, this will decrease the absorption, the distribution, I'm sorry, of this drug. So this will, let's try it with the black, decrease the distribution. So is this always a bad thing? Like, whenever I have a substance that is naturally protein bound, I will just say no to the substance. I will not administer, I will not make a patient take this substance because it's protein bound. When it's protein bound, it will get attached to albumin inside the blood, and then this will decrease the distribution. Actually, no. This could be very useful. Very useful in what? In drugs that do need to be administered with a controlled release. Some drugs, for example, some capsules or tablets that you do take, do not show their effects immediately. They show their effects over a prolonged period of time. One of the mechanisms that could be used for a drug to show its effect in a prolonged period of time is the protein-bound drugs. When you have a substance that is protein-bound, you could make it be released in a controlled release way, which is actually very beneficial in administering lots of drugs. Lots of drugs, when you make their effects immediate, It could be very toxic. So it's actually very useful. And that's why actually, and I've mentioned here that albumin is manufactured, just that's right here, manufactured in the liver, and it gets prevented from getting excretion inside the kidney. That's actually very important for something I'm going to mention in moments. Prevented from excretion in kidneys. So in cases of liver diseases and in cases of chronic renal failure, for example, or a kidney disease, you will have a serious problem in administering these drugs that do have controlled release. We've mentioned that why do we need some drugs to be administered with a controlled release? Because if these drugs showed their effect immediately inside the body of a patient, this will be so dangerous for the patient because the drug will become toxic. This drug needs to be administered over a prolonged period of time. So we sometimes use this mechanism. But in case that you do have a liver disease means that you will have a problem in manufacturing what? In manufacturing albumin. So this means that will you have lower percent of albumin inside your blood or higher percent, you'll have lower percentage of albumin inside your blood. So lower percentage of albumin inside your blood means that there is lower drug, which is the substance that's naturally protein bound. There's lower drug will be bound to albumin. Lower drug bound to albumin means that you will have a higher rate of free drug. Free drug means that it's not bound to anything because you have actually lower rates of albumin, lower percentage of albumin inside your blood. So this free drug means that it will not show its effect in controlled release. It will show its effect in an immediate way, immediately. So as we've mentioned, these substances cannot be it cannot show their effects immediately because they're toxic. So this means that when you have a liver disease or you have a kidney disease, because kidneys prevent albumin from getting excreted, so preventing albumin from getting excreted, it means that it keeps its percent inside the blood plasma constant. So when you have a renal failure, the albumin will be excreted, so the albumin will decrease. So it's the same way. So this will lead to no controlled release, so it will lead to increasing the toxicity of this drug. So let's write this down. Note in cases. Okay. Change this. In cases of, as we mentioned, two organs, liver disease or kidney disease, you'll have what? Increased toxicity, because there is no controlled release of this drug that is naturally protein bound. Increased toxicity of protein bound drugs. Okay? Right. We're actually finished with the distribution part, but we have a very small note that I need to mention. Volume of distribution of the blood, of the drug, inside your body compartments, inside your cells, or inside the interstitial part that's found between the cells and the blood flow of your body, as we mentioned at the beginning of this video. It depends on all of these factors that we mentioned. So let's just write this down. This is blood plasma. This is the interstitial fluid. This is your cell. So the drug getting distributed from here to here or from here to here, all of this depends on all of the factors that we mentioned. The volume of distribution, which is the volume of distribution, will be a higher volume of distribution when the drug gets distributed over a higher body parts to a higher number of cells inside your body. A lower volume of distribution means that it gets distributed to a lower number of cells inside your body and lower number of tissues and parts and And you get the idea, okay? So let's write it here. Higher volume of distribution will mean that this drug gets distributed, higher distribution inside the body. And lower volume of distribution is lower distribution inside the body. Alright, so that's for the distribution regarding the pharmacokinetics part. And yeah, that's it for today. If you have any feedback, please leave it in the comment. I'll appreciate your feedback. And that's it for today. I hope you enjoyed the video, and thank you for watching. Have a great day.